Hi, I'm Dr. Matthew Norton, the founder of People Plus Purpose, and this is the Truth Behind Dentistry podcast. Today, my guest is Briean Clark. Briean is the founder and coach of Pivotal Solutions, and during her 2 decades in dentistry, she crafted a unique method for discussing diagnosis and treatment with patients. Briean is a fellow of the American Association of Dental Office Management, a member of the ADOM Speaker Consultant Alliance, and an active member of Dental Entrepreneur Women and the Dental Speaker Institute. Welcome to the podcast, Briean.
Thank you for having me. I'm glad to be here.
Absolutely. We've already been having some fun in our pre recording moments together. So let's see if we can carry that on and add some value for our listeners in the process. You've had quite a journey. It's I always find it interesting that people start somewhere and then they're usually don't stay there. I mean, I guess some people do, but most people have an interesting story as to kind of the journey to where they are today. So maybe you can give us just a little bit of connecting the dots from kind of where you started in the world of dentistry and to what you're doing now.
Sure. I always do enjoy telling a little bit about that journey. And typically, when I'm coaching or speaking, I do always start with that. And I paint that picture. And I actually had the fortunate ability to start off in the dental assistant realm, but that story too is completely accidental, but I'll spare us that today. But I
Okay.
landed in dentistry from the medical world. And I started off in oral surgery, and then that led me into some general dental opportunities and getting my expanded function license. And then the doctor saying, you know what, you have some personality and you're great with patients. You really should learn the front office too. So I became cross-trained and did leadership courses and ultimately grew into management and overseeing operations. And then I love to show on the slide after that, there was like a bunch of scribbles and just mess, you know? So we often don't talk about the ugly part of the journey. And I joke, there's no crying in dentistry, they say, but there is, and I'm witness to that. And I think, I look back on the journey and I'm okay with what it was because I came out the other side. I'm a little different than some where I have the drive, I have the attitude, I want to be the best, know the most, help the most. And if I have to be there, I might as well be great. So
Yeah.
I do have that drive, but my journey, the messy parts and the tears and the uncertainties and the discomfort, that's what allowed me to show up every day with a smile on my face and be so happy serving my patients, serving my team because I've come through the other side. So it really did shape me into being the leader I am and the coach that I am. So I'm thankful for what the journey was. And and I share that messy part, the part of the scribble journey that not many of us talk about. We talk about the glamorous things and the possibilities and who's doing what and keeping up with the Joneses per se. So I want to talk about the messy stuff, the things that stress us out, the problems that we face, and what the better way is. So that's my passion. That's what drives me is to help people uh, avoid feeling lost, alone, confused, abandoned,
Yeah.
stressed,
Yeah.
tears, and not being successful. And not to be too long-winded here, but that's a part of our positions in the dental office, no matter what role you play. We're going through the motions and we're putting the effort in, but we're so focused on putting the effort in and doing the task that we're not thinking about the result that that's going to get. So I'm always one to say, if you're going to put effort and time and energy into doing something, you may as well be outcome focused, result focused, and want to see something happen from that effort. So I
Mhm.
love helping with that. And
Yeah.
that's a 20-year
Yeah.
summary of the
Yeah.
journey.
Yeah. That's great. I love that. And a couple of things that just I'd like to comment on from that. One is I'm glad they recognized that you had some personality, I guess. Yeah, we have other options. We have other positions for you here because you have some personality. Uh,
Yeah.
but also I think I love the fact of showing up and acknowledging those harder places, those pain points, those struggles. I think people are encouraged to hear them because we all have them. And I've always felt like the best I really have to offer in my service to others, in my coaching, in my practice career previously, is so informed by the hard things that I've had to deal with. So,
Yeah.
and I think the willingness to show up authentically, be vulnerable sometimes, and
Hmm.
acknowledging those things is helpful for the people who tend to be a little bit more reticent to do that because we always want to come across fixed up, professional looking. It's
Exactly.
nice, I think, to be willing to walk into those harder things.
Yes. And those are the people that I can really reach is that doctor, that manager, that team member that is willing to say, you know what, I've tried this and there has to be a better way, or you know what, I'm doing this, it's just not working. There, someone help me.
Yeah,
And because I talk to a lot of doctors that they don't like to say or openly discuss that there's a struggle or there's a
yeah,
shortfall within the
right.
business,
Yeah,
but I want doctors to be the doctor and let's worry about the business side, you know, over here with trained team members and be the owner that's operating the business in a healthy way.
yeah,
So if there is a doctor that's willing to say, you know what, I don't know all there is to know about the business side of dentistry, and I want to be the dentist and have a team that can support me. That's great. And I think more and more these days, no matter what the topic, all the things that seem taboo or embarrassing, we see it every day. Someone's opening up and telling us their story or their problem, and then they see like by them opening up and saying that they've helped someone or they've met someone that actually can help. So it's powerful to finally say, you know what, I think I do need some help.
yeah. It is funny how or maybe it's not that funny, but it is interesting that we seem to be so taught that we need to have it together, right? It's just hard
Yeah.
to acknowledge that we don't. And one of those topic areas, as a segue, is money, right? Talking about money, that's often, if you want to open up the can of worms, probably for some people. Let's talk about money and how you deal with that in your business. So, but you talk about how doctors and team members are not supposed to be kind of the thought is not supposed to be talking about money in the operatory, and you have a different
That's what we're
perspective.
taught. Yeah.
Yeah, you have a different perspective on that. So can you kind of share your approach with us?
Yes, I am really working hard to make an impact in dentistry to reverse that or bust that myth, because we are taught, my experience as a dental assistant is like, oh my gosh, don't answer that money question, don't answer that insurance question. That's the front desk, you
Right,
know.
right,
So
right,
if a patient would ask a money question or an insurance question, doctors are taught and it's ingrained into them as well as the dental assistant of just deferring that,
right,
completely deflecting it.
right.
And I want to say that that is really not the best practice. We need to be able to confidently answer questions, address them, and make the patient feel heard. And then, of course, redirect them to the best person to help them further. But we want to also give that team member a name rather than being in that situation of a doctor recommending treatment, the patient responding saying, oh, well, does my insurance pay for that? And say, oh, that's the front desk. You have to
Right,
talk to.
right,
Let's
right,
say a person's name. You know what? That is Shelly, and she is the best person to answer that question. I'll make sure she's aware that this is treatment that's important to you and that you would like to go over the financial budgeting aspect. And so we want to use names. And that's that transfer of trust through the patient's visit
yeah.
rather than a piece of furniture that, just go up to the front desk and the doctor just kind of cowering away, trying to retreat from the
Right.
question.
Right, yeah, seizing up. I have no permission and no knowledge about the money
Yeah.
story here, right? So,
Yeah.
and that does seem so important too, to make those connections, no matter who's going to be the one primarily talking about it, because case acceptance is so typically abysmally low. And I think a lot of that is the lack of consistent handoffs, communications, and then people being ill-equipped. Even whoever it is that ultimately talks about it is still ill-equipped to really discuss it
Right.
appropriately.
Because the conversation that when the patient asks that question and the doctor or the assistant hygienist, they deflect that to, the front desk. Not only we're not making the patient feel heard and we're not addressing the question, We unknowingly start that process of the patient maintains control of the conversation and we get totally in a mode of it's insurance focused.
Right,
Because
right,
now the patient's asked that question, the clinical team is uncertain of the best way to answer that or uncomfortable to
right,
answer that. We then go up to the front office team member and say, Shelley, they want to know how much their insurance will pay for this.
right,
And then Shelley starts calculating and putting in the treatment plan. And then they go to the patient. It looks like your insurance is going to pay this,
right.
estimates that they pay this. And of course, it's some disappointing amount. The patient's shocked. They can't believe they would have to have thousands of dollars of responsibility.
Right,
But we've started this chain of conversation that is all insurance
right.
focused,
Yeah,
insurance driven.
right.
So I'm working with practices and teams to change that to where we can redirect the patient back to what treatment is important to you. Here's how I can help you accomplish that. Shelley is an amazing person to help walk you through how we can budget and stage your treatment. And I'm going to share with Shelley some of the treatment goals that you've shared with me and what's important to you and begin fostering an advocate type relationship, a treatment focused conversation to really work with the patient
Yes,
to do what's important to them.
yes,
So
yeah,
it's a complete change of how we handle that conversation
right,
and build the relationship, build the trust, and create an urgency and a motivation from the patient to want to do something
right,
about these conditions that we're diagnosing and we're
right,
prescribing treatment
right,
for.
right.
So
Yeah,
it's an amazing process, and when that light bulb goes off, team and patient case acceptance is not an obstacle.
yeah, that's great. Um, yeah, I think it if practices were to pretend even for a moment that they are fee for service, whether they ever went that direction or not, or whatever degree to which they moved away from complete network insurance involvement, gives them a chance to maybe help reconsider the dialogue, right? Like, what would we
For
do
sure.
if we didn't have, if insurance wasn't even a part of this?
Hmm.
Pretend that it's not, and it's all about the person's need and providing
Yes.
options and ways to access the care, and the insurance is the peripheral conversation.
Hmm.
Excuse me, kind of to your point.
Yes, and you're hitting the nail on the head there because the method that I'm teaching PPO practices specifically is how to present treatment based on allowance only information. So if the doctor is passing off to me as an administrative team member that there's a treatment plan for the patient, I'm going to be understanding the conversation that took place in the operatory. I'm going to understand the problems and conditions that were discussed and really understand why the patient needs this dentistry that my doctor has prescribed.
Right,
And now I can look quickly in my computer to see how much allowance does this patient have. Okay, $1,000.
right,
I'm going to go and have my conversation only knowing that they have $1,000. And I'm talking even PPO practices starting the conversation that way because now we can say, Mr. Patient, my name is Bree. My role is to sit down and go over all of the treatment options Dr. Perfect has put together for you today. After discussing these problems during your exam today, can you tell me, after discussing this with Dr. Perfect, what your priority is in the treatment? Tell me a little bit about the goals that you have for yourself or what outcome you would like to see through
right,
the treatment that you've discussed.
right,
And they're going to give me clues now as to why they would want the dentistry I'm going
right,
to tell them about.
right,
And then I use only the allowance first. And once I understand it's dentistry they're wanting for themselves, now I can take that information and be like, let me go ahead and calculate estimates and involve write-offs and all of the things. So it's structured completely different. But again, when you shift with that technique,
right.
it's an enormous, I can't even say it's a game changer. That's
Yeah,
for
yeah.
patient and practice.
Yeah, I think this is just such an important topic. No matter where a doctor decides to fall out on payment options, insurance, and how much they participate there. I mean, personally, my doctor doesn't take any insurance, right? So
Hmm.
I could, in my mind, have that be the limiting factor and say, well, where can I go? And, this,
Yeah.
that. But it's really more, I want to be there. I want this doctor's help. This is what it costs. How much do I feel like I can afford at any point in time of the various elements of services I need, and I make those choices, right? So
For sure.
I think um, I think that consideration and asking people what they value. I mean, it's like, what
Hmm.
is important to you? I think that's wonderful because there's a story behind all of that. And you're right, it shouldn't get caught it just with a spotlight on insurance, right? If that's the
Yeah.
spotlight, you're probably in trouble.
Yes, and that's why, we leave too much uncertainty on the patient side because they leave that conversation with all this information swirling around. And really it's ultimately a big surprise to a lot of patients. They come in and we have to really pop that dental insurance bubble that
You know?
they are, regardless of what dental office they go to, they're going to have this out of pocket cost that they
Right,
have to budget for or choose to invest. And if we're using minimizing language and we're not creating urgency to do something about these problems, and we're not having patient centered conversations, but it's all about, oh, you have these problems. I found these things and your insurance isn't going to pay for any of it. It'll be
right,
$7,225. How would you like to take care of that? They're running for it.
right,
It's all about the process and
right.
handoff and connecting all the dots. I'm sorry, something startled me. It fell outside if I jumped. But it's about having these conversations that really direct the patient and we can advocate for them. And I feel like it's best to have conversations surrounding insurance allowance only because most ethically the insurance company is not guaranteeing or promising us they're going to do something for the patient. So the last thing I want to do is have a conversation with my patient and sound like I'm guaranteeing or promising them something.
Yeah,
So I just get very passionate about the
yeah,
whole
yeah,
process, and
yeah.
that comes from me witnessing as a
Sure.
dental assistant, and then having the administrative side. It was definitely polar opposites of where patients are celebrating their smile with me in the operatory and wanting to hug or hold my hand or celebrate, and then I go on the administrative side and they're like, "Ew, you want money? And why did you do that?" And everything's a blame game, the
Yeah,
insurance
yeah,
disappointments, and
yeah,
it was a lot to navigate
yeah,
through.
yeah,
And
yeah.
so I was able to really blend and merge those two worlds because we have the front office and we have the back office and then this big black hole in the middle. So I really created a process that closes that black hole and gets the communication back office to front office and makes a beautiful cohesive process
Yeah.
that leads to case acceptance.
Yeah, that's great. I think it's just so important that we're talking about this too. I mean, especially when you throw in the element of even with the insurance, it's always no promise to pay, right? So if you get caught completely in that insurance only conversation, away
Hmm.
from the value, their need and the value of what you have to offer, then it's built-in ambiguity where the insurance company puts the doctor and the practice in the middle between them and the patient, and it's really it's the patient that has the relationship
Yeah,
with insurance anyway. So it comes
it
back to
absolutely
having to
is.
be the communicator for the no promise to pay world that's really messing up what people choose to do because
Hmm.
it's not handled well. So I'm so glad that you're addressing these things as a key piece.
Thank you. And I'm so passionate about, like, it's not what we're saying, it's how we're saying it. So I'm working with teams and practices to really just get ourselves out of that corner we've backed ourselves in. We're changing the conversation. It's a total pivotal process. It's a pivotal presentation. We're going to change the trajectory that our case acceptance is on. And it really does change lives of patients and practice. And if you would look at all of the dental office reviews on Google and online, a lot of the negative reviews, it doesn't have anything to do with the dentistry.
Right. Yep.
It's the insurance disappointments, it's the surprise balances, it's the miscommunication, it's
Right.
patients hearing what they wanted to hear and not understanding it's an estimate. So the power of our words, like we can change that
Yeah.
one conversation at a time.
That's great. That's great. And you're right. I've in looking at surveys that have been done, it is mostly a front office problem. Occasionally be something shows up clinically or the doctor,
Yeah,
but
not
it's
often.
the minority. So I agree with you. So is there a takeaway or two that you might something further that we've already talked about, or maybe in an area of something that we haven't that our listeners can put into play?
I can say a couple things to that. I want to get that thought process started for clinical team members and doctors that there are better answers to the patient's questions than I don't know or someone else will answer that. I can help you. I have some free guides and resources. I'm happy to email any of your listeners so they can construct responses to those questions. But the tip and the takeaway I'll leave it will be also on that administrative side, which is a lot of times when we're checking out a patient, we ask them for their payment. Okay, that would be an estimated $324 today, cash or charge. I want to encourage the listeners, share this information with your team member, but actually announce to the patient the total of services that's going to be going to their insurance company.
Mhm.
And it would sound something like, okay, Mr. Patient, your total for today that we'll be submitting to your dental insurance is $2,320. And at this time, your insurance estimates your portion to be $320. And if they would pay any less than they've estimated, you would receive a billing statement from our office. So that way we're going ahead and telling the patient what we're billing and sending,
Mhm.
that this is an estimated payment, and that if there is a balance to that they would see a billing statement. So now the patient's going to know to take action with the billing statement
Right,
rather than what's most common is the patient gets this billing statement, they ignore it because they think, oh, I already paid this when I was in the office. So,
right, right.
so I want to encourage
Mhm.
any administrative team member or those that might be presenting treatment in the operatory and collecting it, announce the full total going to the dental insurance, announce the portion you're collecting as an estimate, and then announce what is next, what the outcome would be, which is they could potentially receive a billing statement from the office, and they do need to respond to that. So hopefully that helps
Yeah,
some of your listeners
yeah,
today.
that's wonderful. And I think, I mean, there's more than one great element in there that I see. One is, I think, positioning the value of the service that you're providing, because if you just tell them how much is their expected portion, they have no idea. I mean, it's like their focus is there, and it's kind of like telling people the retail price and what's on, on sale today for this
Yeah.
amount. It's like the today's price has context to what the normal price is, right? For if you're shopping with that in mind. So I think that value clarification, but also, yes, that's what's expected, and this is how we'll handle that,
Hmm.
takes away a lot of those surprises that are going to make that front office be the bad guy.
Right. Yes, and it helps healthy account receivables because you have patients responding. A lot of positives that come from that. And it takes a lot of the stress off the administrative team member and lessens the future fighting that you could potentially have with the patient on the phone.
Yes,
So
very.
definitely implement language like that. It will change
Yeah,
things for you.
that's wonderful. Well, I appreciate your coming on today and your contribution. Glad you have personality that also brought you to advance in your career, and also you delivered that today. So appreciate the message and the unique way that you're positioning things. And so for listeners who are saying, I need more Briean, I'd like to get whatever she has to that she could give to me,
Hmm.
their patient portion, no, their and to learn more about how you might be able to help them. What's the
Hmm.
best way for people to reach you?
I am actually very active on my business Facebook page, so you can easily find me at Pivotal Solutions on Facebook. Or if you have questions and want some of those free resources I've mentioned, definitely send me an email. And my email address is pivotalsolutionsnow@gmail.com. And I'm happy to schedule a call or start a text conversation to answer questions. I love showing up and being of service, so I'm happy to help.
Wonderful. Well, thank you. I appreciate you. Appreciate the
Thank you. I
time.
appreciate you too. Appreciate
Yeah, thanks.
it.
Appreciate all of you listeners as well. So we'll just have a little love fest for a minute. Thanks for watching. This is the Truth Behind Dentistry podcast. You heard some truths from Briean today. Hope you valued those. I hope you do reach out to her. Look forward to seeing you on the next episode. Tell your friends. Thank you.